professor, physician, epidemiologist. I am Dr. Sri Banerjee. Hello, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. In this video, I'll be showing you how to generate a map in the cloud-based or GIS software. This is a very quick map to put together. It's really straightforward. Doesn't take too much time. A few easy steps. So I'm just gonna go ahead and show you, and then just show you how powerful this map is and what it communicates. It's first of all looking at something called the Places dataset, and Places dataset is powerful. It has quite a few indicators. It uses BRFSS and other data sets. I'm just going to show you here in this website. This is clickable directly from the website I was at before, but it's known as population level analysis and community estimates. And this is part of the 500 Cities project with the collaboration between the Centers for Disease Control, Robert Johnson Foundation, and the CDC Foundation. And so just be thinking about this when you're thinking about any sort of environmental or any sort of sociodemographic variables relating it to specifically different types of chronic diseases, whether it is high blood pressure, coronary heart disease, or anything else. But there's 29 measures for chronic disease-related health outcomes, and then preventive measures. What is additionally unique about this dataset is that it provides place-based measurements that go beyond the county level. So this is looking at places which are incorporated and census designated places, census tracts, and then zip code tabulation areas, or ZICTAs, across the United States. So along with that, of course, there's 29 measures for chronic disease. So these include actually chronic diseases, prevention measures, health risk behaviors, and then even 3 measures for health status. So it's 29 total measures, not 29 chronic disease health-related outcomes. So now, coming back to this map that I had initially started off with, and again, this map will be available for you to click on and explore on your own. So this is not the last time you're seeing this map, but the main thing that is being communicated here is basically medication adherence for individuals that have high blood pressure, hypertension. And this is being done in a different way than I'm used to portraying or communicating these sorts sorts of same phenomena. So usually I've done this with individual level data, but of course with geospatial, you're usually dealing with group level data due to concerns with privacy at an individual level. So for instance, if you get too granular, then you always run the risk of identifying the people that actually have the condition, or whatever it is that you're, whatever information you're collecting. So enough about, talking about kind of the basic gist of this map, but looking now deeper into understanding what are the colors that are of concern, areas of concern, and what are colors that there's high compliance. So let's think about this a little bit. But if we're thinking about high blood pressure age adjusted prevalence percentage, and then if we're thinking about high percentage of taking blood pressure medication, which is designated in gray, then this theoretically would be a preference of the type of outcome that you want. So these areas, even though high blood pressure, there's also high compliance. Now, what you need to be looking into is some of these patches and areas which exist where this may not be the case. And so when you're thinking about places that you want to be really concerned about, this is where there's high prevalence of blood pressure, but people are not taking their medications. And so these are these light blue areas, and you'll see in Florida some areas, but also again in northern Georgia, just going up the coast, you'll see some blue spots in South Carolina, North Carolina, also in the Appalachian region, over here, edging into Tennessee, and then going up into looking at Pennsylvania. Some of the central Pennsylvania, south central areas are low medication adherence areas. Again, northern Pennsylvania has some areas. But also, you want to be looking at other colors as well. Now, some of the lighter colors, they are of less concern because it's both low rates of blood pressure and also low rates of blood pressure, but low rates of adherence too. So you might want to look into and see that maybe at even more granular levels there might be some areas that need to be addressed, but overall those are not areas of concern as much. Areas where there's higher blood pressure medication and not as much blood pressure in the area, this is usually typically something that's good, because then people are really taking care. Maybe they're going even earlier and trying to address some of the pre-hypertension. So I would still look into some of these areas, and anywhere that you have maybe kind of lower rates of blood pressure adherence, blood pressure medication adherence, regardless of what the other status is, you might want to actually take a look into those areas as well. So medication adherence is a common problem, but the main point that we're trying to look at here and communicate is that when you're looking at a health condition in conjunction and in the context of an equitable measure, like medication adherence, then this can reveal a lot more information about areas of need within communities all across the United States, rather than just looking at one attribute at a time. And you can also see, I think, one other area that I want you to appreciate before we stop talking about this is that the idea that you can measure adherence effectively using Places dataset and just the various datasets that are available to you. I hope this has helped you better understand hypertension and medication adherence and how all of that relates with each other in a geographic context. Thank you for listening.